Hi, Jennifer. This is Megan Fortney, and I'm just going to give you my verbal presentation for my SOAP note. My patient is a 47-year-old Caucasian female who has ambulated into the emergency room complaining of shortness of breath and mid-sternal chest pain beginning 3 hours ago while she was at work this morning. Chest pain is isolated to mid-sternal area, doesn't radiate anywhere, and she describes it as achy, dull, throbbing, and does not go away. Her shortness of breath she describes as being left to felt breathless at times. What aggravates it, she says, is if she attempts to take a big deep breath or induce any type of self-induced belching to help, none has helped. What she did try before she came in, she took an extra dose of her Pantaloc 40 this morning when the pain first started. An hour later, she took 2 extra strength Tums, which did not help. And then while en route here, she took 2 puffs of her teenage daughter's Ventolin puffer, which has not helped. And I did deter her from doing that again, as it's not her prescription. She rates her pain as a 6 out of 10 and denies any history whatsoever of chest pain or shortness of breath like this before. Nobody in her house has the same type of pain right now. With that said, though, last week, her entire household was sick with what she describes as flu-like symptoms of fever, chills, body aches, shortness of breath, sore throat, joint pain, etc. So reviewing symptoms, pertinent positives, mid-sternal chest pain, shortness of breath. She says she has a dry cough and is describing anxiety-like symptoms probably related to the shortness of breath, with feelings of dizziness, lightheadedness, which she feels could be related to hypoglycemia, as she hasn't had lunch yet. Pertinent negatives, she denies any abdominal pain, nausea, vomiting, or diarrhea, headache, blurred vision, worsening cough, cold or fever, recent falls, injuries, no pain upon voiding, no muscle skeletal pain, back pain, no changes in her menstrual cycle or gynecological concerns. And she denies any numbness and or tingling to her 4 extremities. She has a no known allergy, she tells me, but is latex sensitive, which is rash inducing only. She has a Mirena in, which is not new. She takes Effexor 75 and Pantaloc 40, which are not new medications for her at all. What is new is a recent IV infusion last week when she was sick with the flu-like symptoms of what she calls an immune boosting vitamin mix, which is B vitamins, vitamin C and magnesium in a 500 ml bag given intravenously, as well as she takes Alamax, which is the brand name for stabilized oral allicin, which is the quote-unquote good part of garlic antiviral, antifungal, antibacteria, which is just at your local health food store, probiotics and multivite, vitamin D, and as well as melatonin. Past medical history speaking wise, she's adopted, therefore she's unable to know any family history, which is unfortunate for her in that regards. Tonsillectomy and adenoidectomy at age 7. She has struggled with menorrhagia, was previously followed by gynecology, hence the Mirena. 2 previous full-time vag deliveries, as well as an emergency C-section with her last. GERD, anxiety, panic attacks, iron deficiency, anemia. Interesting enough, she just had a medical completed by the local nurse practitioner at the family health team, a full workup, which was all normal. No concerns to report. Her last menstrual cycle is absent due to the Mirena, and she's had no breakthrough bleeding or spotting. Last breakfast she ate this morning, full meal, and her last bowel movement was regular this morning, no concerns. She's married with her husband and all 3 children living at home. She admits to being a previous half pack per day smoker, but is down to 3 cigarettes per day and typically 2 to 3 glasses of wine a week. She denies illicit drug use, but will use marijuana edibles to help sleep. Usually active 2 to 3 times a week, typically walking and or yoga. Immunizations are up to date, including her COVID vaccines. She admits to having an increased stress recently with her aging parents, as she's a bit of a caretaker at times. Her occupation, she's a full-time elementary school teacher, which I feel increases her exposure to potential hazards, viruses, bacteria, due to the large number of children. and no recent travel to the country. And like I had made mention last week, her entire household, herself included, were sick with flu-like symptoms. So when she ambulated into the emergency department, she was alone, noted to be mildly distressed but stable, well groomed, pleasant, and dressed appropriate for weather. It's obvious that she's in pain. She's slightly hunched over in her chair, holding her chest, and she's slightly restless at times. She's alert, she's orientated, GCS of 15. Pupils are equal and reactive. On assessment, her vitals, she's a bit hypotensive at 94/56, tachy at 110, rest rate is 24, temp is 36.7, 96% on room air, and she's got a weight of 95 kilograms, which is the norm for her, no recent loss and or gain. So assessment-wise, respiratory, she is tachypneic with a rate of 24, but all respirations are of normal rhythm and depth. There is a slight effort on her part for breathing, but she's able to answer all questions and speak in full sentences at all times. No audible sounds of breathing and or wheezing heard. She has mild use of her accessory muscles, but negative for any type of tracheal deviation when I palpated her sternal notch, and no retraction of her inner spaces during inspiration. Inspecting her chest, there's no obvious signs of trauma, bruising, and no asymmetrical movement whatsoever. Palpating her chest, she describes as having no pain or tenderness anywhere when touched. She has normal chest expansion when I palpated, a normal tactile firmitis. And then beginning at her apices, percussion-wise, all of it is normal at each level. No concerns there, and as well percuss, normal diaphragmatic exertion. No concerns about any type of restrictive lung disease. Auscultating wise, normal air entry and no adventitious sounds heard. Cardiac assessment wise, she's able to lay supine 30 degrees, no concerns there, and no increase in shortness of breath and or chest pain when doing so. Her overall skin color is good, but she is slightly diaphoretic. Bilateral arms, no edema noted, and normal color, normal texture of her skin, normal turgor, no concerns about dehydration, no prominent veins noted, and no clubbing of her nails upon assessment. Good cap refill and bilateral radial pulses I would grade as 2+. Abdomen is soft, tender, bowel sounds are present, passing flatus. Denies any pain upon voiding. Lower extremity wise, no edema to her bilateral lower legs, good skin color, temperature noted throughout, and good pulses are palpated. No rashes, scars, or any type of ulcers noted. Looked in between her toes. I did check and she's negative Homan signs to both of her calves. I got her to stand. She has an appropriate hair distribution throughout her bilateral legs. No obvious signs of any vascular disease, and her varicose veins noted. Pulses are normal and equal bilaterally, low extremities. Up to her neck vessels, I inspected before I palpated her carotid. Normal, no pulsations, and negative for thrills when I palpated. Jugular vein pressure was assessed and it was normal at 1 centimeter. No apical impulses visible and or heaves when I inspected her chest. And again, no heaves and or thrills when I palpated her pericardium at all anatomical sites, that of the aortic, pulmonic, herbs, tricuspid and mitral area there intercostally, as well as during auscultation, no murmurs heard. I did check for mitral stenosis with the bell of my stethoscope by getting her to lean over and listening at the mitral area there. And then for any aortic murmurs, sitting up, leaning forward with the diaphragm of my stethoscope, both were negative. Lab-wise, she needs a full workup. I would say a CBC with a diff, lights, probably extended lights, a BUN creatinine, LFTs, INR, PTT, troponin, a random glucose, BUN, liver function, a D-dimer, which you hope is negative, a TSH, which I know won't be back today, a CRP, as well as a ferritin, just because of her iron anemia history, which again won't be back today. Diagnostically speaking, a 15-lead ECG actually should be done, or should have been being done during an interview. And it shows a normal sinus tach with non-specific ST segment and T wave changes. And a chest x-ray is negative as per radiologist. So in summary, this 47-year-old female, typically healthy, who has ambulated alone, obviously unscheduled into the emergency room, presenting with mid-sternal and chest pain and shortness of breath, which started abruptly 3 hours ago. What I was hoping to present was a patient who is struggling with an acute viral-induced myocarditis, probably from last week's flu-like viral symptoms. Thank you.